Serving all of San Diego, this is your Fox 5 News.
A little ironic this morning, saving yourself from the sun that is beating down on us as we speak. This is our two-part series. Listen to this statistic. Did you know that young women are 8 times more likely to develop skin cancer today than they were 40 years ago? We're joined by Dr. Melanie Palm of the Art of Skin MD here to answer your questions about prevention and detection. Good morning, doctor.
Thank
first
you,
of all.
Raul. It's nice to be here.
Boy, that statistic, is that really true? And also young men 4 times as likely to battle the disease? Wow, shocking.
It is. And you know, it's actually Melanoma Awareness Month is May, according to the Skin Cancer Foundation. So we're really trying to make patients and all of San Diego very aware of this disease.
Let's get to some of our viewer questions. A lot of people have questions. You would think folks by now understand how this stuff works, but we have to answer these questions to make sure everybody's protected. Our first one, this one says, I use a skin cream with 10 SPF and a face powder with 15. Here's the question we get a lot. Can I add up the SPFs? Does that mean I'm using a 25 on my face every day, doctor?
So that's actually a misconception. You can't add them together. But what you probably could do is if you're applying an adequate amount, that second one, that's the SPF of 15, is probably what's holding you. So it's not a 25, but it'd be a 15.
Use more if you're concerned about that. Use something that's in the 30s and the 40s.
Exactly.
Okay, our second question reads, isn't it true that our bodies need vitamin D from unfiltered sunlight for at least 20 minutes a day to be healthy?
So if you ask almost any board-certified dermatologist, I think most of us will say we'd rather get your vitamin D through diet than through the sun like we're in right now. It's true that it only takes about 15 minutes, just about 3 times a week to actually get adequate vitamin D. You're getting that going in and out of cars. But we really want you wearing sunscreen because the UV radiation exposure greatly increases your chance of getting a skin cancer, and getting it through your diet is so easy.
Okay, so through the diet is better than, okay. Third question here, where are the top places skin cancer hides on women, on men?
Sure. So a little bit differentiation between the sexes. Men, it's typically head and neck, and on the back is where the tendency is to get a lot of sun. And for women, because we wear things like skirts and shorts, legs as well as arms are a little bit more common.
There you go. That kind of makes sense, but a lot of folks don't know that. Okay, next question. Does SPF 4 or 7 that we see on different body oils offer any sun protection at all?
So it does, but it's not great. And so what the SPF is your sun protection factor. It's a matter of sort of telling you how much protection against UVB that you have. 4 isn't great. You know, the recommendation by the FDA is at least a 15. Most dermatologists will say actually at least a 30.
You can never be too safe when it comes to this kind of stuff.
And there's always self-tanner.
Yeah, exactly. Okay, we have some pictures of melanoma. This is what's so serious. A lot of folks look at themselves, try to determine if there's something that should be looked at. We want to see these pictures. While we're looking at this, we're going to walk over here and perform a skin test on a young lady that is joining us here this morning. So, doctor, from those pictures, a lot of people tend to see that. And well, I don't know, should they be concerned or what the issue is, but let's kind of walk through. Hello to our young mom.
This is lovely Josephine.
Hello, lovely Josephine. How are you? Thank you for putting yourself here as part of our experiment here. Okay, doctor, I guess show us how to perform a test like this.
So I recommend to patients, it's the recommendation from the American Academy of Dermatology, that once a year everybody should get screened from the top of their head down to their toes. And at home they should be doing it once a month. And so patients a lot of times are surprised that I actually look in people's scalp when I start off. I actually look at their conjunctiva, so inside of their eyes, inside of their mouth. Those are areas where you can actually get skin cancers, including melanoma.
I don't think people are aware of that.
I know, and they're actually surprised. You know, looking between toes, you can get moles and changing spots even in between the moles, and even where the sun doesn't shine. Although about 85% of non-melanoma skin cancers and 65% of melanomas are related to the sun, there are a lot that aren't.
Is there any way you can kind of maybe guide us, and just from the look of this young lady in her arms and what we can see here?
So Josephine is half Irish, so she's gotten some moles from her dad. So she's definitely someone that has probably more than 50 moles, a little higher risk for developing melanoma. So usually what I'll do is start with the face. If you can, when you get out of the shower, shower, part the hair and have somebody that loves you take a look in between. And then I progress down on the face, looking for signs of the A, B, C, D, and E's. And so moles that are abnormal have asymmetry, that's the A. Their border is irregular. Their color either has several colors or is an odd color, like pink, really black, purple, white, blue. Diameter, if something is larger, and actually Josephine, I think on her right sort of upper arm, has a mole that's approaching that's almost 6 millimeters or larger. That puts you at a little higher risk. And then E is the most important. That means evolving. If something is new or changing, itchy, painful, bleeding, growing, it's something you should see a board-certified dermatologist
Okay,
about.
quickly, we're running out of time, but I wanted to get quickly through these products, if you could, to help us out.
So we just gave you a couple of different things to take a look at. These are actually physician-dispensed 8am. They have a high percentage of titanium, or excuse me, zinc oxide. Zinc oxide or titanium dioxide are great physical blockers. So we really like these. They're micronized so they don't turn white on the skin. And then over the counter, there are some great options too, including Neutrogena. But I tell patients you really need to, this is actually what you need to apply on your body each time, every 2 hours you're outside a shot glass.
Every 2 hours, it's this amount that you need to have that
And that's
protection.
surprising. We usually do a fraction of that.
Yeah, that's surprising. That's actually a lot.
It is.
Right?
It is.
This is great because we have free skin cancer screenings that I know we put up the information just a moment ago by Dr. Melanie Palm. Wednesday, 20 Lounge in Cardiff. Such great information, and I hope really people listen, pay attention. The summer is here. Everybody needs that protection. Look at this, people. A shot glass. A shot glass worth. All right. Thank you, doctor.
Thank
you,
you,
Josephine, as well. Back inside to you we go.